Welcome to the office.
All right, talk about your hip. You were saying something about the hip.
The hips have no discomfort,
Okay.
but it's what I see that troubles me. Whenever I put my feet together, it looks like my left knee is
Behind.
longer. No, the right is behind. I don't know if...
Sorry, this one is behind, yes.
Or this is further. I'm not sure how...
Well, let's take a look and see. Let's put the heels, so we're matching his heels. Put your heels on the ground. Come forward. Okay. And what do we see here?
Left is...
Gonstead actually talked about this, and this is due to pelvic misalignment.
Okay.
So we're gonna look at this on the X-rays. This is kind of cool. So if any of you guys want to guess what you think it is right off the bat, this knee is going forward, this knee goes forward, this is back. But the other, sorry, I got to bring this up. The other interesting finding, this looks bigger than this.
But this is bigger on the upper part.
Correct.
This.
But this is bigger at the bottom.
Yes, yes.
What's up, dude?
No, yeah.
So he got a great VMO. Look, his VMO is very developed here. VMO is very developed here. It's developed here too.
But not so much.
But it doesn't look the same here.
I know.
So this looks bigger. So we look at this muscle and this. Look at my hands. Now let's do the same thing here. He's right.
This is bigger. Vastus lateralis, I think.
Lateralis is bigger. VMO is bigger here. Well, what's the nerve that controls all this stuff?
I don't know.
There's a couple of them.
Okay.
But quads are going to be L2, L3.
Okay.
T12 can go here. Okay,
Okay.
L1. But we're looking at the mid lumbars. If we're talking about specific nerve
Okay.
supply to the muscle.
Okay.
But we're going to go deeper than that, and we're going to talk about the imbalance of all the muscle on that side because of the imbalance of
In
the
the
pelvis.
pelvis. Okay. Okay.
So bigger here, smaller here, smaller here.
Yes, exactly.
Okay, continue on, sir. Ankles.
I think that my left, surprisingly, has basically my calf. I think has less ability to contract.
So less plantar flexion down or dorsal up?
The motion is the same, I think, but the ability for the muscle to contract, I think the right contracts better than the left.
He's given us the answer already. What's the nerve that controls that? Comes from the sacrum, right? S1, S2.
Okay.
So this is all, we're starting to get some patterns now.
Okay. Is this all connected with the...
It's all connected
Okay.
to your sacrum and your pelvis,
Okay.
yes.
Okay.
Okay, anything else going on?
Everything else is just minor things and not considered problems. For example, my grip on the left, I think the left is weaker.
Are you sure?
Not very sure.
Let's see.
Okay.
Maybe it's perception. Squeeze with the right hand as hard as you can. Let go. 120. Squeeze with the right hand as hard as you can. Let go. And 110. Just a tiny bit.
Okay.
110.
But I was right.
Let's try that again. Do it again. Okay. 110.
I was tired.
115, sorry. And let's do that again. Let go. 110, so it's a little bit off. So on the second go, 115, 110. On the first go, 120, 115. So about 5 pounds. Okay. That's going to be a good test for us later. All right.
That's all that I can think of.
Okay, let's get started. And what we'll do is let's go over your X-rays. Kostas, let's look and see what we have.
Can't wait.
After that, we're going to do your exam, figure out where we're going to start.
Okay.
After we're done with you, we have another guest here, don't we?
Of course.
All right. And then she's up next. Hey, who are you?
What?
Who are you?
Who are you?
Who are you?
Zoe.
Zoe. She came with you?
Of course.
Welcome.
Alright, let's go over your X-rays. This is you, sir. This is a picture in time. Tells us how you've evolved from birth. This is looking at you from behind. This is the right side. This is the left side. This is your side profile. On the side profile, we are designed to have 60-degree reciprocating curves. First good news, your curve is good in your low back, decent here. Even in the mid, but what happens here is you have the reverse curve happening in the very top for some reason. And that's what we need to figure out, okay?
Okay.
Now let's zoom in. So this curve is good here, but then the question is, why do we kink forward from there? That's what we need to figure that part out. And we're going to come to this X-ray in a lot more detail. We'll come back to this in a little bit. Okay, let's go here now. This is your 24-story building. In order to have stable building, we need a level base and foundation, and that's the first thing we need to assess. Let's look at your foundation and let's see what we see. Now, I'm saying there's some digestion stuff going on here, and your case is actually kind of interesting in regards to the digestion part, because that is the best Megan Blasi we've ever seen in this office.
Okay.
At least that I can remember.
Okay.
But why is all this like this? So it's not that I'm going to give you anything for your digestion. I'm hoping through the nerve, through what we find, we should be able to help that. Okay. If I didn't see a Megan Blasi and I saw all this, I'd be a little more concerned.
Okay.
Okay, but again, I don't have that answer just yet.
Okay.
Not yet. Let's look at the foundation and let's take a look. So, what are some of the things we see here? We do see a tilted pelvis. I actually see a little bit off on the pubic bone. You see how this is small, this is big.
Okay.
You see that?
I see.
It's due to the alignment. So let's go over the numbers and I can explain it in a lot of detail. Now, what do the numbers tell us? We have a rotated sacrum on the left side that's dropped on the right. We have a rotated pelvis, and the listing of your pelvis tells us this was due to some sort of trauma. It wasn't a postural thing. It was some sort of fall.
Okay.
Okay, and I'll explain it in a minute. And then we have a 3mm short leg on the left side.
Okay.
Here's the thing. If I work on your hips, is going to make that more. So whatever happened started in your tailbone. The hips came later.
Okay.
Now follow my process. Here's why. If I adjust your pelvis, it makes it 4, but if we can get this up here, it makes it back to 2.
Okay.
2mm is coming from here.
But again, it's gonna leave 1mm down there.
Maybe 1 or 2. That doesn't matter regardless.
Okay.
As long as it's under 7mm, adjustments will hold. Now, I had a case where I tried to bring it up. But by trying to bring this case up, I should actually share the case. We using the heel lift, and by using the right amount of heel lift to level his base, he ended up getting more twisting in his pelvis, which made it worse. Okay. So we found a happy medium where he'll have a little bit of an imbalance in the hips, which is totally fine for him. Okay. But there's no rotation.
Okay.
Now, in your case, we have significant rotation of the pelvis, but I don't see that I want to start there. I want to get it up first. I want to get that tailbone up.
Okay.
Then we can deal with the pelvis. Okay?
Okay.
But I say that, and then it's whatever I find on you.
I have something else I forgot to tell you before. My left leg has limited external rotation on the hip compared to my right.
Yes.
It's less. It's obviously less.
Agreed.
Okay.
And the question is, did you have some sort of bursitis or any hip injuries? Because when we're looking at the hips, I mean, we can see through the hips there, but there's a little bit of, this looks a little bit different from
the left.
Yeah. So this area looks the capsule or the labrum or something. You didn't have any labral tears or anything back in the day. I don't know.
Me neither, because do they produce pain?
Some people will say yes, some people will say no.
I never had pain in my hip.
Then, okay. So in your overall, what do we see? We have a tailbone issue.
Okay.
That's where we're going to start in your foundation. Once the tailbone issue is done, then hopefully we can start on your L5 while you're here, because the L5 is also causing this tilting. Okay?
Okay.
Now let's go to the full spine so I can show you. Let's go back here. So we'll start on the foundation, somewhere down here. It starts to tilt to the right, it compensates to the left. Now, this is where the fun starts. Compensates to the left, but then it goes again to the right.
And the neck is...
Now, follow my... You said if you sleep on your left side, correct?
I don't have stomach issues, yes.
But when you sleep on your right side?
I do, or on my back I also do.
I don't know why the back is causing it. We need to find out, but 1, 2, 3, 4, 5, 6. I can see why sleeping on your right side could cause it. Sleeping on your right side, think of the high side of the rainbow here, okay? Do you see this?
Yes.
High side of the rainbow in any curvature should be face up. So if you sleep left side down,
Faces down.
this is the high side of the rainbow, everything is fine. When you sleep on your right side, it's pinching.
Okay.
The concavity, there's a concavity, so it's putting pressure on that part. But it's also putting pressure in the upper cervical, and you can see your capsule here compared to here.
It's different.
It's different. So the question is this smaller or is this swollen? That we'll find on the exam. You follow me so far?
Absolutely.
Okay. So we have an upper cervical potential. We have something going on in the upper back here. Because this kink, the question is this kink. T1, 2, 3, 4, 5, 6. And you have a side slip at T6. And that's why it hurts when you go on your right side. Or you get reflux. Okay. So we have a T6 side slip. We have something in the top there. L5. Let's go on the side here. When we look at the tailbone overall is decent. Overall is good.
Okay.
We got a couple of nubs here. I'm pretty sure I'm going to find something here around S3, S4. I'm pretty sure. Now, once that's done, like I said, once we figure that out, we'll probably need to go to your L5. L5 is tilting a little bit. 4 is tilting. 3, 2 comes back at 1. 1 is level. 12, 11, 10 starts to tilt again. These discs are all fantastic, by the way. Your discs are great.
Okay, that's good.
These discs are great. This is a little bit less than it should be, L4. L5 is generally going to be smaller than the rest of the disc, but L4 seems to be wearing out a little bit faster, and probably because it's a compensation. There's probably a lot of more movement there. These discs are perfect. They're great. Looking at the neck, C2, 3, 4, 5, 6, 7. Like I said, there's something going on that caused this little kink here. And we're going to see if we can change it through some postural habits, okay?
Okay.
Now, let's go to the flexion extension. Yep, extension, they all go back. Flexion, they go forward. This one didn't move. That's the culprit. 2, 3, 4, 5, 6. Number 7 did it. You see it's still tilting back. It's still stuck there. So we have a C7, we have a T6, and we have your foundation.
Okay.
That's what I see there.
Okay, okay.
Okay? Shall we get started, brother?
Of course.
Let's do it. And let's watch you walk. So we got the Greek boxer, huh? Walk to the corner of the room and back a couple of times, a few times. And whatever your normal walk is, please. Good. You feel you sway, right, when you walk?
Always.
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 So he walks side to side when he walks, okay.
And my balance is off some of the time.
Walk on your toes, please, and keep going. Turn around, walk on your heels. He's not getting the right one is harder or left one is harder?
On my heels. Not sure. Both.
Keep walking.
Again?
Regular walking now. Slow. Yeah, so what's happening in his tailbone, he's not doing this. He's going this way, side to side.
Okay.
Come over here and have a seat. Let's get started. Starting at the base of the neck. And the first thing we're going to get is the base, C6, C7. There it is. Then he's got a lot of heat up here too. I've got to bring it out. C1, C6, C7. And all of this is going to change after his foundation. Cool. T6, left side, 5 points. There it is. S3, S4. Down in the low, low. Cool. Let's do static palpation. There we go. Now, edema starts there, disappears right after there, continues down, starts up again on the left side, but that's skin. 1, 2, 3, 4, 5, there's your 6. Yes?
I'm not sure.
You're not sure. Now the problem is he's a boxer, so he's got a high pain threshold. That's the problem. So I can't ask him what hurts. I have to go on objective findings. So we're looking at instrumentation, edema, static, and motion palpation. Open and close your knees, please, with your feet touching. Open and close. Feet together, knees open, knees closed. Open and close. Good. Right side only, please. Open and close. When he does the right, the whole left is shifting. Left side only. When he does the left, the whole right is shifting. So it's the sacrum. It's the tailbone. Sit up straight, sir. Good. Back slowly towards me. Number 5. 1, 2, 3. That's where I'm finding it, right there.
Okay. It hurts more on the left, I think.
Yes. It's more swollen here.
Okay.
Right there. 1, 2, 3, 4, 5. 6, 7. 6. S4. Sit back for me, please. Back. Let's check the neck. Motion palpation. 7, 6. What am I feeling for? As we extend the head, we're going to feel those spinuses come back. As we flex, they open up. So we're looking for that flexion extension at each individual segment. That one's not moving right there. There we go. 7. 7 is not moving. 6 is moving. 7 is not moving. We have 7, we have 1. We have to do divorce test now in the front. And let's go ahead and do divorce test. Divorce test is this, right? We're going to isolate extension and we're going to isolate the neck, upper and lower cervical. So when we look up, we're isolating the lower cervical. And now we're going to turn left versus right.
I have pain on the left under the ear, I think.
And to the scapula? Or just in the neck?
Right here.
Got it. Okay. Now, that's the lower cervical. So we can justify C7. Look down, turn left. So right now, it's okay up top.
No pain at all.
So we're going to go with 7. 7, 6, S4. Sit up straight. I want to test your shoulder. Sit, 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 sit. shoulder range of motion. Let me test it. Yeah. Not smooth. Come here, listen. Now the other side. Well, this we already know from the clicking. Okay. You're gonna make me work. So let's talk about the scapula.
Okay.
Subscapularis, muscle that controls underneath. The bursa, all of that comes from where? C5, C6, C7.
Okay.
Nerve supply.
Okay.
So we will test the mobility of the shoulder after the adjustment.
Okay.
I probably, for today, since you're here for a little bit, we're not going to work on the shoulder today. We're going to start on the spine,
Okay.
foundation, ankles, okay,
Okay.
and jaw.
Okay.
That's where I'd like to start for today. And let's see what happens.
Okay.
Okay? You ready for me?
I am.
Let's do it. Sit back there, sir. So let's get some listings. 7 is a PLS. 1, 2, 3, 4, 5, 6. T6 is a PLS side slip. And PL sacrum on S4. Everything is on the left, I agree. Sit back there for me, scoot your butt back, sir. C7, PLS. We're hooking right underneath there. Chin back. Let's see if we can open it up together. I gotta open the front of that body. There it is. Open it up. Drop it down. Down. There you go. Home run, baby. Welcome to LA. Come on down. Face down. Relax the shoulders down. Down, 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 down. S4, torquing up. You got him? That's the home run, baby. PLS side slip. We have to do this in 2 parts, okay? 1, 2, 3, 4, 5. Part 1, PLS side slip on the transverse process. That's part 1. Part 2. 2, 3, 4, 5. PLS on the spinous. And bury it in. That's the home run, baby. Step away from the vehicle, sir. Walk it out. He got his dimples back in his butt. Check out your husband's butt.
I think I feel a little pressure on my lower back after the adjustment, I think.
You feel what?
A little pressure right down here. Do I see it?
Walk. Look at his dimples. Tell me if you see the difference. So before he was going like this, now he's going up and down like this. Doo-doo. Walk one more time, please, and we'll continue.
Okay. Βλέπει διαφορά.
Mm-hmm.
I think I walk more straight now.
Back over here and have a seat. We'll get there. All right, let's run the meter and see what we got. Neck is clear. Bring your shoulder hand up. Test your shoulder.
My left.
Yeah.
I think it's
It's a little different. Still a little restricted,
yes.
but different. 6 is clear, neck is clear. Sacrum is clear. Scoot forward, sir. Scoot forward, forward, feet together, open and close the knees. Right side only, please. Left is fine now. Right, left side, right is fine. So both hips were stuck from the sacrum. Both hips are moving now. Go on your back, sir. On your back. Cool. Let's do the ankles. Raise your right leg up. Left leg up. Sit up and turn, please. Now, let me test out the shoulder.
It's the same as the...
What's that?
I think it's the same with the right.
That's scapula. Let's do the TMJ. I will start on your scapula.
Okay.
Sit back for me, please. Look up. Slowly open. Right side comes out first. Keep going. Okay, so we have that right AI. We're going to do the right side. Let's get the condyle block so we have something to stabilize the back of the neck. Doo-doo. Okay, open wide, open, open. Now, slowly start to close. Good. Open. Slowly start to close. Good times, brother. Let's go over here face down, please. Let's work on your scapula. Left hand behind your back. You're going to come over here down on your knees, please, ma'am. Slide up, sir. Slide up. And you're going to catch like a catcher. One hand here. Like,
Okay.
Relax first. Relax there. Catch, don't push. So I'm going to be over here. It's all good. I'm going to lock the piece of the Hylo. Now, the scapula adjustment is not a true joint. It's a functional joint. There's a bursa that sits inside. And what's going on with him is the subscapular bursa is inflamed. That's why it's not gliding smoothly. What I'm going to do here, relax there, we're going to start to glide it this way. Deep breath in, blow it out fast. And you're going to catch. Relax here, please. Relax the elbow. Deep breath in and out. There you go. Hand forward, please. That's it. And let's check the rib. Right there. Deep breath in. Blow it out fast. Try not to push me. Let it go down. Tummy down. Down, down, down. Gotcha. Home run, baby. Good job. All right, Kostas, let's walk it off, sir. As you're walking, a few times back and forth, first thing I can see, we can all see it. He got his groove back in his dimples. Yes.
It feels different now. I think I can keep a straight line when I walk.
You're not dragging that right foot as much. Remember, we'll go back to the video. He's dragging both heels. You're not dragging as much now. It's there, but not as much. Walk on your toes should be easier now.
Yes, a lot.
Good. Turn around, walk on your heels should be easier now.
Maybe harder on the right. Maybe.
Have a seat over here, please. And let's do the buff and polish. Good stuff, brother. Stand up, sir. Turn around, face me here. Let's check the hands. Squeeze light. That's it. Squeeze. Let him go, please. Lunate. Elbow first here. Lunate. Scapula. Elbow. Lunate. Scapula. Slowly open. A little different. I'll take it.
Okay.
That's where we're going to start, okay?
Okay.
Questions on anything I did today or found?
No, I don't think I haven't.
Pop your clavicle a little bit. Keep going. Keep going.
If you push, it will stop.
Oh, okay. Go on your back.
On my back.
Then I push for you. On your back. On your back. I push for you. All the way back. There. SC joint. Back over here, sir. You can put it on or off your choice. Have a seat. Now let's get into the scar tissue of the subclavius. You okay with that?
Yes.
Now let's try this side here. It can get it a little deeper. Go ahead and try to click.
I cannot. It's less. So it's
So this is to break up scar tissue, okay? Sit up. I will have to sit this. There you go. Good.
okay.
Okay. Move it back and forth. A little different. That's where we're going to start with you, okay, sir?
Okay.
Squeeze.
Okay.
Not hard, just that one's solid. Squeeze. Good. Squeeze. Welcome to the office.
Nice to have you.
Nice to meet you, sir. Welcome back, sir.
Nice to meet you again.
Good to see you. So, tell me if anything is different from our first visit.
It is.
Tell me.
First of all, in my lower back, for the first time ever, I have some kind of pressure, of stiffness. And without me trying very hard, it cracks when I...
So it releases now.
Sometimes, but I feel some pressure to have gathered there. For my scapula, it's the same. For my collarbone, it's 50% better. Still clicks,
Sure.
but not so bad.
And the pain is, there's no pain there. Or was there pain in the clavicle?
There was never pain in the clavicle, but I have the symptoms from yesterday. in my trap and in my chest area, under the collarbone and
Okay.
in the near of the shoulder.
Okay. You ready for round 2?
Of course.
Jaw, nose.
Nose, no symptoms at all.
Good.
The jaw was hurting yesterday from the right, but it was the motion was better, I think,
Okay.
a lot better.
Good.
The only thing I noticed no difference was the scapula.
Okay. And that's going to be our funnest one to work on.
Okay.
All good. Let's run the meter on the back, Kostas, and let's see what we got going on today, okay?
Okay.
Starting at the base of the neck. Let's see what we got going on today. We gotta find that nerve hiding out. Levator scapula. Upper traps. Lower traps. So is it that it's too tight, or is it that it's weak down here? That's what we're figuring out.
I get pain in both
Both what?
positions, upper trap and lower trap.
Interesting. Let's hunt. There. Huh. Let's hunt. That was interesting. We got that around T6. I got around C1 up top on the left. Up higher around L1. All kinds of stuff shifted around. It's pretty cool. Sit up straight, sir. What do you see? Come on, seriously? His L5 sacrum is clear. Come on, seriously? It's not supposed to be clear. It's not good for my business. So, at least for today, I'm not touching the sacrum.
Okay.
We're going to go up higher today.
Okay.
So I'm getting here. I'm going to count in a minute. I'm getting here, here, and up here today.
Okay.
Those are the 3 I'm getting today.
Okay.
Let's check the movement of the pelvis and see if we're going to work on it. Feet together, scoot forward. Open and close your knees with your feet touching. Open and close. Right side only. Left side only. Right side. I'm actually going to bring the left side up to, sorry, the right side I want to bring up a little bit. Do the right. Keep going. Do the left. So what I'm doing right now, guys, so you can see, is I have my fingers in the front on the AIS, okay? Because right now in his scenario with my thumbs on the back and he does it, go ahead and motion.
Both?
Open and close, yeah, both. Do the right side. So I do feel when he does the right, the left shifts with it. Do the left side. And when he does the left, I also feel the right shift with it. But when I put my fingers in the front here, if you want to see what I'm doing, and my thumbs back here, I'm grabbing the whole pelvis. And now when he does the right, you can see the whole hand move. Do the left. When he does the left, it's not, so it's the left pelvis we need to work on. That's kind of cool. So by putting my fingers in the front of the pelvis on the AIS, we get to see the whole hand kind of move with it then. 5, 4, 3, 2. Number 2, number 1. Number 2, that's actually moving. Number 1. Tender here
Maybe.
or here? This one more here, top one, or bottom one?
I think top.
12. Right pelvis, Left pelvis, T12.
The difference was not too much though.
4, 5, 6, no problem. 6 or 7?
6, definitely 6.
6. L1, T12. T12, T6, and let's check up top, please. Sit back for me. As you look and see, tell me what you see. You know what's interesting? I just thought about something. That his neck, this upper could actually be coming from an atlas. It's so misleading. But we'll do C2 left, C1 right. Okay. Look up. There you go. Now I got to bring my elbow down just to get across that lateral mat. That's what's different from yesterday. Home run, baby. Walk it out. So what I had to do different, it didn't work the same yesterday. I was more here. I brought my elbow down to get a better line of correction.
The second was wrong.
That was deep. The first one was preparing for the second one.
The second went down all the way between my shoulder blades.
That's the cord. Spinal, that's the cord. That's the pressure on the spinal cord.
One near on my toes or?
No, regular walking. But can you just humor me and bring your hand behind your shoulder and see if that changed? See if it changed.
Maybe not sure. Not
Why don't you turn around so we can see it on camera, because I have yesterday's video, right? Okay. Try it. Just so we have something to compare.
Maybe.
It is. He just doesn't want to admit. He want to travel halfway around the world to see me.
And he's in denial.
And you're in denial. Face down. Now for his 12, the reason I'm going to do a thumb paisi. This is his 12 if you look over here. This is his 12. So it's kinked up on that right side. I need to put my thumb there, and we need to shove it in there, so to speak. No pun intended. 5, 4, 3, 2, 1, 12. Now I need to be on the right side. You're tensing on me, brother. Drop. Never mind. No fun. There you go. Tickle. Come on up. It's a good one. Walk to the corner of the room, please. Take your time. Check out your husband's butt now. Check out his butt now. Yeah. Yeah. He's got some baklava in there now.
Okay.
Have a seat. Let's do the ankles. Raise the right leg. Raise the left leg. Sit up and turn. I want to work on the TMJ. Open, slow. Right side. And close. Open. 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 Close. Ah! Anyone ever do that to him before? Open.
Very nice.
On your back. Let's do the nose. Why don't you come help?
Me?
Yeah, come over here. I need you to hold him
Strong?
into the table.
In, okay.
As strong as he'll let you. Not too strong.
Pata.
Right there.
Pata.
Lean back. No crack. There you go. Gotcha. Let him go. What you can do to each other, there's a very nice breathing point.
Ah, okay, press.
So I teach you guys can do it also, you guys out there can do it. So you go from the nostrils, you
Out.
go up and out
Uh-huh.
and push down and breathe in.
Okay.
Yeah, it's a very good breathing point.
Okay.
Now watch, I'll show you another one. Take a nice deep breath in and out. Take a breath in. Sharp, right? Now take another one.
Right was
Sharper,
was-
yeah.
Yes.
So listen, breathe in and out. So when I push in the left side, breathe in, no change. Breathe out. When I push on the right side,
It's deep.
change.
It feels like my right nostril cannot.
Open. But when I push here, it's better. Do it again. Watch. So I'm going to put a gold-plated pellet here in his ear.
Okay.
He's going to rub on it throughout the day.
Okay.
Okay? And it's an
Acupressure.
it's an acupressure point. And just it'll help his breath, okay, as we're going through this. Okay? All set, bro. He can push on it and massage it throughout the day, okay? Walk.
Το ξέρω, το έκανε και εμένα.
Walk it out, sir. I'm giving you gold.
Right ear was painful.
That's the one I'm putting in now.
Okay.
And have a seat.
Καλύτερα.
You go. So what I'm putting,
Με τη μέση
no needle, it's just a little pellet.
Okay.
Okay? And you're putting it right on the point. I'll teach you the point later, okay? Right there. You can keep it on until it comes off.
Okay.
You don't have to take it off while you're here, okay?
Okay.
And if I decide to take it off, I'll take it off and replace it. Right there. All right, dude. Awesome. Stand up for me, please. Squeeze. Easy, Taylor. Easy. Slowly, please. Relax. Squeeze. Relax. Just a little bit on the radial head in the back here. Drop it down. So, squeeze. Let go. We're all good.
Okay.
You're all set for today.
Thank you.
You're very welcome. Welcome back, Kostas.
Nice to meet you again.
Nice to meet you again. So, we've had a few visits.
We did.
How are we doing?
Very good results.
Let's talk about
Very,
it.
very nice. Very
Talk-
nice.
Talk to me.
So, jaw is okay. I think it's clear now. Opens and closes.
That was one of the main reasons you came
Yes.
was for your TMJ.
Evenly. Now
Okay.
the opens and close. Very good. Very
Okay.
nice. The symptoms from the clavicle still popping. Less. Symptoms lower from the clavicle. I have none.
Good.
Nothing.
Okay.
But everything is on the trap now.
Okay.
Okay. It
Okay.
was trap and chest. Now it's only trap.
Okay. So it's getting better. It's getting better here.
Yes. I think I have no symptoms or maybe very little.
And the popping and clicking
It's less, but it's still
there. And part of that is going to be rehab when you get back,
Okay.
right? Because you're going to retrain your ligaments.
Okay. Okay.
And a couple of the things, number one is going to be flossing for your shoulders. It's a video I have on the YouTube
Okay,
channel.
Okay.
Yeah. Planks.
Okay.
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 I know
I
you
like
love.
it.
I know you love your planks.
Okay.
And then as you get better with your planks, which I know you already got the strength, you can put her on your back.
Okay.
Hold her up.
Nice.
Okay. So
Okay.
you get that resistance as well.
Okay.
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 You'll feel it. And then the other part of the plank is to, when you're in plank position, I'm obviously not on the floor, you're going to go down, you're going to do a little bit of serratus anterior. with that.
Protraction and retraction of the.
Correct.
Okay.
And a little bit of serratus. So you can even do with a 5-pound weight on your back,
Okay.
the boxing muscle, serratus anterior. You know it better than anybody. Okay, so we're going to do a little bit of serratus this way. You're going to do your reverse shoulders,
Okay.
Not- right? 25 to 30. 3-4 times a day.
This gives me clicking, but it, okay.
It's okay. Go forward with it,
Okay.
because you're going to get the movement. Then you're going to do some isometrics, and you
Okay.
want to do proprioception. Okay?
Okay.
What else? Scaption exercises. Right?
Okay.
External rotators.
Okay.
Internal rotators. 90 degrees. External rotators. Internal rotators.
Okay.
Back in. 45 degrees. External rotators.
Okay.
Right? You're going to hit all those different ones. Clavicle. I like if we're using a band, okay, and we're doing shoulder flexion with bands.
Okay.
Cool? Then as you do that, you can do compound. And this, now we have to figure out how we're going to do it with a band. Maybe you'll know better. I want you to go up, back, and this.
Okay.
I'm going to show her. We're going to go shoulder flexion, we're going to pull back, and we're going to externally rotate. Go back, okay?
Okay.
And you're going to feel all in here when you do that. The last thing, you're going to do, you know how you take the dumbbell typically, and you're on your back, and you're bringing it overhead?
Okay. Dumbbell pullover, I think it's called.
Dumbbell pullover,
Okay.
with band though.
And the resistance comes from
The band from the floor. Okay? So you're
Okay.
pulling over.
Okay. Okay.
And this, you're going to do more endurance training. Actually, with all of this.
Okay.
Endurance training means 4 sets, 25 reps. Last set to burnout of the exercise.
Okay.
Okay?
Okay.
Simple. Let's continue.
Okay. Most of those exercises I already did, but I had no from the left scapula control.
I'm going to work on that still.
Okay.
I'm saying when you go back, you're not doing it here.
Okay. Okay.
Okay. So jaw is better.
Jaw is excellent. It's fine.
Popping is a little bit less.
Like 50% less. A lot less.
I'm good with that. You've had it for how many years?
12 maybe.
Okay. Chest symptoms.
Chest is 80-85% better, I think.
Okay.
Maybe it's in my mind that I have symptoms. I don't know. Trap is the same though.
Okay. Back. How was this movement? Remember you were...
It's perfect. 100%.
Yeah?
Yes.
From our last visit?
Plus,
Damn, we didn't do a video.
plus it stayed.
Huh?
I've noticed that when we do an adjustment, I'm perfect here, but when I leave, it's still better, but not so much. The rotation stayed the same. It was perfect. Even today, if I tried, it's the same from one side to the other.
It is.
It's the same, yes.
Same meaning it's better, or it went back to what it was?
It's the same. Each side. It's 100%.
Oh, they're even.
They're even. Yes, they're even.
Cool. Okay. All right.
Only leg is still different.
Discrepancy.
Yes, and it's more the discrepancy here than in the X-ray.
Go on your back. Over here, please.
Okay.
Face up. So, let's just rule out. Let's measure it.
Okay.
Just to make sure that there's not the anatomical component.
Okay.
Lift up. Bend this knee, please. And let's measure. I'm looking for symmetry. Straighten it out, please. Bend a little bit and down. 20 and a half. 21 minus 1 is 20. Let's go this side.
From the legs, it's short.
It's not the femur. 21 minus 1, 20. Okay. So then that means our focus now is the
Sacrum.
right pelvis, and we gotta do them both. Sit up for me, please. Okay. So we're gonna meet her on the back. You ready for me?
course.
Good. Starting at the base of the neck. Five points, C1. So the trap can be coming from different places.
Okay.
It can be coming from spinal accessory nerve, which is the atlas, C1, up here, upper cervical. It's actually cranial, spinal accessory nerve is cranial nerve number 11, but we can affect it through the upper cervical adjustment. It can be coming from down here, 5 points. It can be coming from the shoulder. It can be coming from the scap. We're going to check C1 and C6 up top. Actually, I have a better idea. That's only 1 point. And the other thing you want to work out is also your lower traps, right? Lower traps, when you work them out, lower trapezius, they pull the scapula back, less chance of shoulder injury and less pain, okay? All right. L5 is actually clear. Sacrum is clear. We're doing pelvis. Back slowly. Bottom of the joint, middle, top. And guess what? This is gonna be a fun one because I gotta do a PIIN. It's gone down and in, which I normally like to do a pull move. But because it's in the convexity, we're gonna have to go involve side down for that adjustment. It's a special adjustment. Huh?
Spicy.
Not spicy. Not tart. You're gonna learn today. 1, 2, 3, 4. It's not in the book. Tender?
Not so much.
Okay. Tender?
Not.
Okay. Then I'm staying in the parasympathetic nervous system, and you're going to tell me tomorrow how that did with the reflux. Okay?
Okay.
Fair enough? Sit back for me, please.
It's tender there though.
Not so bad here.
No, on the left.
All there, left. Okay. Let's check it out. It's actually C2 that we have to work on. That's 1. That's 2.
Yes.
It's 2. C2 and right pelvis today, okay, sir?
Okay.
Let's do it. Can I have you walk it off a couple of times? I want to see the back of your walk. Let me open up the back here. So we have something to compare to the first visit. Go ahead and walk to the corner of the room and back a couple of times. There's still that little tinkle, but the dimples are definitely moving up and down better.
I have better balance, I think.
What do you notice in him?
This.
Better balance? Okay. Okay, have a seat, let's get started. So today's game plan, C2, right pelvis, check the TMJ, oh we didn't check the TMJ, he said it was perfect, let's see, open. Well then I guess I'm gonna, so you want me to do the deviated septum adjustment or you want me to do it boxing style?
I prefer boxing style.
What's the hardest part of training to be a boxer? What's the hardest part?
The mental part.
Not the physical?
No.
You can run 30 miles, 50 Ks?
At some point you will be able to. First day 10 miles, second day maybe 20.
What's your record?
Of what?
How far have you?
I never did too many distance. Too
Okay.
much.
So what was your main training then?
Like HIIT.
Big bag, speed.
Everything. Big bag, a small bag, a speed bag,
Mm-hmm.
jumping rope. technique, tactics, all this.
Cool.
Coordination maybe.
You know Muhammad Ali used to live over here, right? In this neighborhood.
I have
in
no
Hancock
idea.
Park. Yeah. He used to live in Hancock Park
Okay.
when I first moved here. Okay, let's go over here. You ready?
Yes.
Okay. Let's do C2 first. Okay, let's do C2 first. C2. And I gotta clear that muscle a little bit to get right on that bifid, right underneath there. And it's gonna be light. Make sure we don't lose it. If I go too far up in extension, guess what happens? We lose the contact and you rattle. Nice and easy there. Good. Good. There. Look up. Come on down. One
Oh,
here,
okay.
one here. Left hand behind your back, please.
Here.
Yes, sir. Lift up. There you go. Catch. Don't push. Deep breath in. All the way out. Gotcha. Okay. Walk it out, sir. And let's go right side down now. So PIIN, I'm on pisiform contact on the PSIS. And I got to bring it that way. Up and out. Let it roll. Let it roll. Gotcha. Walk it out. Nice little conk. This. And walk it out. So. Let's go face down over there, please. I want you to raise your whole left leg up as high as you can. No pain with that, correct?
No.
Raise it up again as high as you can. Good. And down. Raise your right leg up as high as you can.
Higher.
But it shouldn't be. If it's PI, it should be harder. Raise it up again.
Left or right?
Left, please. And down. Raise it up again, please. Left. Pretty cool, huh? Left side again. Right side again. Oh, come on. Walk it out, sir. That was pretty cool, huh? And now look at the dimples in his back. A little bit better. Okay, sir, back over here, please. I just want to check the movement of the pelvis now. So when we're doing motion palpation or static palpation in the Gonstead work, it's static. PI, if it's down, is going to be more tender on the top. If it's AS, it'll be more tender on the bottom. EX, the whole thing will be tender. IN, it's usually in the front, which we can't actually palpate. Motion palpation, I'm on the top of the joint, coming back slowly towards me. Middle of the joint and bottom of the joint. Left side, top of the joint, middle of the joint, and bottom of the joint. A little bit right there.
Maybe.
Maybe. Now, I'm down low. Okay. Sharp?
Not sharp, no, not at all.
Sharp?
No.
Cool. Let's re-scope, make sure everything is clear. Sweet. Starting at the base. Doo-doo. C2 is clear. T2, T3 showed up. Sit up straight, dude. Let's try that again. Maybe it's the posture. Never mind, it's the posture. So when you're slouching, you get pressure here.
Okay.
When you're sitting straight, there's no pressure. All clear. Cool. Now let's check that. Ears, shoulders, and the nose. There's no adjustment.
No.
Snoring's not coming from there now. As you get your curve fixed, as you work on the curve, that little reverse up top, and we've been working on it through the adjustment too, it will get better. We'll use the wedge in the meantime.
And the towel.
Yes. Okay, good. All right, you're all set, dude. Stand, check it out.
Check what?
Duty. I don't either. Just give me a second. Go face down over here. Yes?
Yes. Not so much.
Bring it out. Let's work on the posterior tib. Bring it back a little bit. Now the fun part. Don't kick me, dude.
I will try.
Traction. I got a traction, open up the joint. There's the lateral capsule and meniscus. So I'm working the bulge that's created from the misalignment of the tibia here. 4, 3, give it to me, dude, come on. There. Almost, come on. Yeah! There. Bend the knee. You gotta give it to me, sir. Hold on to the table in the front, please. On top. Slide down a little bit. There. There you go. On your back, a little more. Bend the knee. Relax it. There. Stand up and walk it up. And then let's retest. What?
It was painful.
Have a seat. Mira.
I think it's better.
Bring it together. What do you think? Looks different to me. Can you look? Tell me.
I think it's the same.
It's even.
It's even.
Yeah,
Can I do my testing?
Sure, do it. Halas.
No idea. I cannot see up here.
Oh, why don't you come over here, Shasha? All right. So in that position,
It's always worse, I think.
this one's a little forward.
Yes.
Now sit. Do it again.
Here is this.
They're even. Alright. I'm going to let you guys figure out what you think it is. And we're going to talk about it tomorrow's visit, okay?
Okay.
Sound good? So in this position, seated, weight bearing, he's fine. Non-weight bearing, so weight bearing, he's even. Non-weight bearing on your back. This is non-weight bearing. Go on your back, please, and bring it up. But also remember, dude, you're not sitting the same. So if we look here, we got to even this first. This is not even. So let's even that first.
Okay.
And then let's see. First, let's make this even. So make sure your heels are even so this comes there. Good. Now why don't we look up top there? Look up top over there. Okay. Bring the knees together. Don't give me your middle finger, bro. Relax your head back. Good. So there's still a slight discrepancy there. And we're going to need to figure out why is that. So anyone have any ideas? Let us know. Let's see what you guys think. Okay, you're all set for today. Squeeze. Squeeze.